A consultant pediatrician from the Obafemi Awolowo University Teaching Hospital, Ile-Ife, Professor John Okeniyi, joins us via Skype for more. Good to have you join us, Professor Okeniyi.
Good morning. Oh, good afternoon now, sorry.
So, on the one hand, we're recording more cases, but on the other hand, our active cases is still quite low. Some people will say it's quite low, looking at the fact that it's just about 4,000 active cases. So where does this leave us? Are we at the point where the federal government should declare a third wave?
We must remember that our active surveillance is not optimal. And if we rest on our oars that all we have is 4,000 active cases, we will miss the whole point. Until we then have a full-blown disease or disaster on our hand, it might be too late. What I think is more cardinal is the trend that there are now increasing numbers of cases as well as active numbers of cases. And I can assure you, if we have 4,000, we may have 10-folds of that because we're not making case diagnosis or case definition. We're not screening it actively enough. Only suspected persons that come our way, then we test and find. There is still a high percentage of asymptomatic cases and spreaders in the community. It is a fact that globally the third wave is hitting and moving around the whole world, and I think we are in the third wave already.
So as we speak, the National Emergency Operations Center has now activated level 2. Talk to us about what that means, or has been activated at level 2. Talk to us about what that means and what commensurate action should follow up with that activation of level 2.
This time last year, when such was also activated, there was increase in dissemination of public information via all social media, the other news media, print media. That has been activated, but mind you, Nigerians are no longer so active on Twitter. So the daily breakdown we used to get, even though the NACA and every other agencies are dishing out the information, it may not be getting to the end users. If we're not going to open up the social space, then the print media and TV and other electronic media must be revamped to make people become more and more aware. I will think that we should increase consultation with religious bodies and schools, tertiary institutions and secondary in particular, because the third wave globally is being propagated by this Delta variant, and the hallmark of the Delta variant as against what was going on this time last year are that one, it seems to be going on amongst unvaccinated persons, amongst younger persons, and then the virus does not stay too long in the upper airway. So many a times you have false negatives by the typical nasal swabbing, and it goes rather fast to cause lower respiratory tract infections. So people need to become more aware of this. The religious bodies, I think it might be safer to say we should reduce our gatherings now and go back to more virtual interactions. Likewise, the universities and tertiary secondary institutions. I think that is where the level we should be at now. There should be increased awareness. We should reduce our gathering. Of course, we should continue all the other preventive things we're doing, whether masks or this kind of masks.
Just basically the non-pharmaceutical protocols, social distancing, wearing a face mask, and all of that, especially now that we have a very low level of vaccination with our population. Thank you so much for talking to us, consultant pediatrician from the Obafemi Awolowo University Teaching Hospital, Professor John Okeniyi.
Thank you very much.